Hello friends, welcome to Creative Medicine. In this lecture, we will learn about clonidine. Okay, Mr. Rushel has severe hypertension. Mr. Rushel has severe hypertension and is to receive minoxidil. Minoxidil is powerful arteriolar vasodilator that does not act on autonomic receptors. When used in severe hypertension, its effects will be when minoxidil is a vasodilator, right? So it leads to whenever there is vasodilatation, it will lead to reflex sympathetic stimulation. So because of reflex sympathetic stimulation, this will result in tachycardia and increased cardiac contractility is seen. Clonidine is an antihypertensive agent used for fast intravenous injection. It can increase blood pressure due to its agonistic action on vascular alpha 2 adrenergic receptors. Because of their agonistic action of vascular alpha 2 adrenergic receptors, clonidine is used as an antihypertensive agent. Thank you and thank you for watching.